Are you interested in becoming a Psych NP? Or are you on the fence on which specialty to choose as a nurse practitioner? Well, in this video, I'll be going over 5 reasons why you should become a Psych NP. If you are new to this channel, let me formally introduce myself. I'm the Psych Dude. In this channel, I'll go over several subjects to educate the public about mental health, subjects to improve mental health, and ways to improve your overall lifestyle. I hope you guys enjoy this video. Don't forget to like and subscribe for future videos. Let's go. What is going on, everyone? It's a Psych Dude. I'm back with another video. Well, as many of you know, I recently made a video on what a Psych NP is, and I wanted to follow up that video with why you should become a Psych NP. Yes, you. If you missed that video, please go ahead and watch it right after this one. But basically, a Psych NP is an advanced practice registered nurse. We received extra training on how to treat individuals with different types of mental health disorders. We received specialized training to treat individuals with mental health disorders, and we can prescribe medications, so that is a big one. Yes, we are able to prescribe, and we examine patients, we diagnose mental health illnesses, and provide treatment options much like psychiatrists do. I do go into further details in that video on what a Psych NP is, so go ahead and watch it right after this. Without further ado, here are 5 reasons why you should become a Psych NP. So reason number 1 is job satisfaction. As Psych NPs, we get to do so much. We get to assess, we get to diagnose, and we get to ultimately treat individuals with many different types of psychiatric disorders. And just being able to serve them and help them with everyday processes, we're able to have some satisfaction within doing our job. We get to prescribe medications, we get to perform therapy, we get to contribute to policy development, we get to assist in healthcare reform, we can own our own practice, and in different states we do own our own practice and we can run independently. We can work within our communities, we can give back, we can work within hospitals or even corporations, and we can even function as consultants or liaisons to patients and families with complex issues. We have so many different options out there to help people and to help communities with different treatment options. And through all of these opportunities, you'll be able to find your passion in one setting or another. If you're not passionate about in one thing, you can be able to use that to go into a different type of specialization within psychiatry, which brings us to reason number 2. You get to specialize within psych. Not only do you get to specialize within psych, but you get to specialize even further within a certain population of psychiatry. So according to American Psychiatric Nurses Association, you have the options to specialize in child and adolescent mental health, emergency nursing, geropsych nursing, military mental health, and forensics, just to name a few. But like I said earlier, guys, you have so many different options out there, and if you want to specialize even further within mental health and hit that specific topic, you have that option. So reason number 3, there's improved technology compared to other medical fields. So psychiatric mental health or psychiatric medicine is always growing and advancing. As mental health awareness grows, so is the advancement within technology. The US is starting to use so many different types of medications, and there's an ongoing list of new medications out there updated in ways of treating mental health illnesses and have advanced screening processes. We have a pill that actually has a half-life of over a week. We even have long-acting injectables with some lasting in your system for as long as 3 months. Can you imagine there's a company out there where you use swabs to swab the inside of your cheeks and it can show you how well you metabolize psychiatric medications? With that technology, you have a better chance of finding the right medication for the patient the first time, instead of constantly trying so many different types of medications, ultimately postponing the time frame on which they will get back to their normal selves. Also, there's many advances within telepsychiatry, TMS machines, and other ways to ultimately treat mental illness. And psychiatry is booming. It's booming, guys. So definitely take a look at that. Like I said, guys, psychiatry is booming, and reason number 4 is you'll be in high demand. Psychiatric specialties are in high demand due to the lack of providers, most especially psychiatrists. Due to the lack of psychiatrists, they're looking for more Psych NPs out there. According to Mental Health America, 6 out of 10 adults with mental health issues receive no treatment. Yes, you heard that right, guys, no treatment. And this is primarily due to the lack of providers out there. So as Psych NPs, there are more and more psychiatric providers are needed, and you need to fill that gap. With such high demand for service providers in this arena to care for existing patients and helping new ones, the demand for more advanced practice registered nurses to pursue this specialty is likely to grow. Honestly, I have so many recruiters sending me emails, giving me phone calls, sending me LinkedIn requests just to be able to provide or be able to show me new jobs out there. And they probably do this on a weekly basis, and that shows you just how much the demand is out there. So reason number 5, job growth and salary. NP's job growth is reaching an all-time high. ONET Online reports job growth for nurse practitioners to be 22% from 2012 to 2022 with 58,000 job openings. There are only a small percentage of NPs out there that specialize in psychiatric mental health compared to the amount of psychiatric mental health jobs out there. If you watched my previous video on what a Psych NP is, I did go over salary, and I will make another video going over the exact amount of salary and how you can make that money. But if you haven't seen that first video, please go back and watch it. But pretty much you have several different factors that range from the type of employees you are, your location, and your setting. But based on research, if you are looking at the average, you're looking at $90,000 to $140,000 and upwards into $300,000 as a psychiatric nurse practitioner because of the demand. Honestly, being a Psych NP is probably the most rewarding career I've been in. I've been in sales, I've been a registered nurse in the ER, and I've been an inpatient psych RN, but being a Psych NP is probably the most rewarding because you get to interact with family members, you're able to see how much you've impacted their lives, and you get to truly make that impact. You get to treat patients with both therapy and medications, and you get to help people get back to their normal lives. Not only do we need more of Psych NPs, but so do patients. They count on us. They count on us to get them back to their daily lives. If you have found this video interesting and would like to see more videos on topics like this, please comment down below on potential topics. Thank you for joining me, the Psych Dude, and don't forget to like and subscribe. Until next time, take care of yourselves. Psych Dude is out.